Nuevo Memory Garden Cemetery in Ramona is the final resting place for more than 1,000 souls. It opened in 1893 and sits on 10 acres. Adorning the entrance is a plaque recognizing two of the cemetery's 3 current board members. One is William Biggs, who joined the cemetery district's board more than 34 years ago. The other is Daniel Vengler, who's been a board member for over 30 years. There are no term limits for special district boards in California, but an expert on good governance says he's never heard of anyone serving this long. Yet he's not surprised it happened.
Almost all special districts are under the radar. Nobody pays very much attention to them.
Bob Stern is co-author of the state's Political Reform Act, which governs how public agencies should operate. Special districts, he explains, are self-governing.
Well, generally the county is at least having some sort of monitoring them. They get away with anything they want to.
And whatever they want is what the cemetery board has been doing, says 40-year Ramona resident Pete Smith. He first took interest 3 years ago while sitting on a committee that oversees county audits.
Highlighted was a comment by a county auditor who caught in his review of the statement that 2 of the directors were paying themselves health care benefits, which the auditor thought was unusual.
The report was sent to the county's civil grand jury, which investigates such things. But Smith says nothing changed. So he dug deeper and found that since 2011, the Ramona district has paid a total of $402,123 in trustee health benefits. Benefits they voted to give themselves. KPBS confirmed what Smith found. And reviews of the other 3 cemetery districts in the county found that none of the others paid their trustees health benefits.
My biggest concern as a taxpayer is how are these monies being used?
Smith was joined by a KPBS reporter at the board's monthly meeting in early August. It was his second appearance at a board meeting to ask about their health benefits. During his first visit, he was told to provide proof. On this visit, he provided it, the district's own records.
Of the cemetery districts in San Diego County, only Ramona pays their directors any form of health care.
The California Controller's website shows in 2021, Trustee Biggs received $15,168 in health contributions, and Trustee Vengler got $34,800.
This same amount, this $34,800, is greater than your maintenance worker or your maintenance supervisor gets in a basic salary.
The salary figures for the full-time maintenance workers and John Vargas, the district manager, are also on the state website.
Who gets $34,000?
I don't know. I don't know the financial stuff.
You don't know who gets this money?
No, I don't.
Well, how about this $15,000?
Well, that would be the second one.
Yeah.
They told the KPBS reporter to check with Vargas to clear up his confusion about their health insurance.
That's a lot of compensation.
I can't address that. I'm sorry.
Okay.
But then, 24 minutes later, Vengler made a surprise announcement. He says the board should give employees a 5% raise and stop paying for his and Biggs' health benefits.
We want to reverse a motion that was made in 2011 that the Ramona Cemetery District pay the CalPERS health benefits in full for trustees.
Biggs and Vengler were reappointed during the 28-year Supervisor Diane Jacob was in office. Joel Anderson succeeded Jacob in 2021 and reappointed the board members. We showed him what we found.
I was shocked to learn what we learned.
The supervisor said his options are limited.
We're actually doing the research on what we can and cannot do. I made some of these appointments back in 21 when I first got elected, and nobody else applied, and there were no complaints, and I had no idea.
The Cemetery District Board met again last week. They acted on the proposals Vengler made at the previous meeting, and it went a step further.
They wanted a copy of your check. I redacted information.
Vengler paid the district back for his insurance costs with 2 checks totaling $303,658. And one more thing.
As far as the health care benefits in CalPERS,
The board members agreed to terminate their health benefits. Maya Trabulsi, KPBS News.